Part 5 regarding intestinal worm infestations. Okay, in this one disease condition, that is the Giardiasis. Okay, this is the Giardiasis. It is one of the childhood disorder. It will be caused by some type of worms, hookworms or the pinworms or the tapeworms. Okay, in this we are going to discuss about first definition. Okay, what is that particular definition means? In this first one is the inflammatory process. The Giardiasis is a one disease that will be caused due to the some of the infection, especially inflammatory process. After infection, the disease will cause some inflammation. Next, the intestinal condition, especially here the Giardiasis will be affected to the particular part, that is the intestine of the human being. It will be caused by the overgrowth of protozoa. Okay, the disease, how will it will be caused means the disease will cause overgrowth, excessive growth or increased growth of protozoa Giardia lumblia. Okay, the disease will cause overgrowth, increased growth of protozoa Giardia lumblia. Okay, it is a one type of infective organism to the Giardiasis. Okay, next one is the what is the source of infection? How the Giardiasis will cause to the human being? What is the best source for this type of infection means in this untreated water contaminated with the Giardia lumblia cyst. Okay, some water who are drinking, as a human being we are drinking some water, no? Okay, the water which is contaminated by the Giardia lumblia cyst. Okay, this is a major infective organism for the Giardiasis disease condition. Okay, this is the main source for the Giardiasis disease condition. Okay, next one is the etiological factors. Okay, what are the etiological factors for the Giardiasis disease condition? In this, the Giardiasis will be spread by the fecal-oral route. The Giardiasis easily spread by the fecal-oral route. Means the food will be enters into the mouth. It will be reaches through the esophagus up to stomach. In the stomach, the food should be digested or some amount will be received by the intestines or the waste products will be excreted through the large intestine and anus as like some feces or the stool. Okay, this is the process for normal mechanism of the digestion. Okay, once the food will be digested, some waste products should be excreted from the body, some energy should be received to the all body parts. Now, here what happens means the fecal-oral route means once the infection will be there in the human body, the infection from the intestines, especially Giardia lumblia cyst. Okay, this cyst will be there in the stool of the human being who are affected by this type of organism infection. Okay, this type of cyst will be contaminated food or water. Okay, the food or the water should be contaminated by the Giardia lumblia cyst who are taking this type of contaminated food material or the water. Okay, those healthy persons also affected by this type of Giardiasis disease condition. Okay, another one is the children who attended child care centers. Okay, some children are going or they are attended in the child health care centers. Why? Because due to some infection or due to the some another reasons they are attended in the some child health clinics. Okay, for treating their infection or for improving their unhealthy status. Okay, for reducing their sickness. Okay, due to what happens means in that the child compulsory, once the child will be attended for the clinics means compulsory their mother gives some diapers for wearing. Okay, here what happens means due to these diapers, the child may be highest risk for the Giardia limbliocyst. Okay, due to the diapers, due to the children's diapers, high risk for the this type of Giardia limbliocyst. Next, who drink from the, okay, some individuals taking some water from the rivers or from the streams. Okay, they are taking rivers water for drinking or streams water for drinking. Okay, there is no drinking water, there is no filtration. Okay, unfiltered water they are drinking. Okay, due to that reason what happens means some unhealthy children or some children are affected by this type of Giardiasis disease condition. They are having a open defecation process near rivers. Okay, the infection will be, the eggs or the cyst will be easily contaminated the type of river water. Okay, who are drinking this unfiltered water. Okay, the unfiltered water contains some type of infection. Okay, the eggs will be easily spread by the oral route. Okay, this is the one way for contamination of food materials. Okay, sometimes in the some children are having the disease spread by the ingestion of contaminated feces. Okay, ingestion of contaminated feces usually by the hand to mouth contact, means once they are going to defecate the stool, okay, they are not following hygienic practices. Okay, after completion of defecation process, they are not following hand washing techniques. Okay, some eggs or some infection will be there, their hands. Okay, they are taking some food, means the infection or this type of Giardia limbliocyst may be enters through the mouth. Again, the infection will be caused to the children. Next, the cyst also present in the toys. Sometimes the kids will be playing with some toys or some benches or some tables, okay, or some type of utensils. Okay, they are playing with the utensils or toys or some type of tables. What happens means the child will have some infection with the Giardiasis disease condition. Okay, in the Giardiasis what happens means Giardia limbliocyst may be having some or releases some eggs into the external environment. The eggs may be contaminated that particular utensil. Okay, the infection will be easily spreading through the utensils or toys or the tables. Okay, one person to another person by the uncontaminated process or by the contaminated with this type of Giardiasis limbliocyst. Okay, next one is the weakened immune system. Okay, in the children who are having the weak or low immunity power. Okay, those children may not be tolerate this type of infective organism. Okay, who are having good immunity power, they are tolerate, they are fight against this type of particular agent. Okay, due to the less immunity power, these type of antigens or this type of infective organisms number will increase. Antibodies which is protected their body, their antibodies will be reduced due to the low immunity power. Due to that, the child may be suffering with this type of Giardiasis disease condition. Okay, next, due to the malnourished children, they are not having proper nutrition due to the malnutrition, protein energy malnutrition. Okay, proteins loss, energy less. Okay, some type of vitamins or some type of minerals will be less in their body. Okay, next, some individuals are having the low stomach acids. Okay, sometimes from the stomach they are not releases any acids. Why? Because in previously they are undergone some stomach surgeries, means due to the stomach cancer or due to the abnormal communication between the stomach or esophagus or stomach or other related parts. Okay, due to these reasons the child stomach means some part of the stomach should be completely removed from the total stomach. Okay, who are undergone this type of stomachectomy, okay, those people, those children may be affected by this type of Giardiasis disease condition.